Congress to require warning labels on social media platforms. Dr. Vivek Murthy says that social media is a major factor in the mental health crisis among young people in the country. And to dive into this a bit deeper, we have Wish TV medical expert Dr. Janelle Gordon here to help us with this morning's checkup. Dr. J, thanks for stopping by. Obviously, this is a huge topic when it comes to social media in children. So let's just get right on into it and how we can compare these two things. What do the statistics show?
Sure. So what we're seeing is that children who spend 3 hours or more, and a good amount of them do, on social media have a twofold increase in the risk of mental health concerns such as anxiety and depression. Also, almost half of our current adolescents are reporting issues with body image due to social media. And then we also know that about a third of them are seeing decreases in their grades because of their social media use. So it really is a growing concern.
Okay, those are very alarming statistics for sure. So what are some things that parents can do to just nip those things in the butt right away?
Sure. So what we're recommending, and if viewers want to know more and look into it in detail, they can go to the U.S. Department of Human Health and Services. Dr. Vivek Murthy last year in May 2023 put out a Surgeon General advisory in the interim until we get a Surgeon General warning. And what we're saying is that children really should not be using social media until they're around high school age because the brain is still going through development, and some of these push notifications that are being sent out, some of the ads that are popping up due to the algorithm really can do harm to children, as we stated, with their mental health. You can limit screen time, and there are apps that you can use to do that. We recommend no more than a couple hours daily. If you notice that some accounts that you're following are putting out disrespectful or violent content, you can unfollow them. You can even mute them if you don't want that person to see that you have unfollowed them. And just be mindful of what you're giving your children exposure to and when. So we talk about social media free zones, such as around bedtime, dinner time, and social gatherings.
All excellent recommendations. Let's dive back into this entire crisis as a whole. Not to age us, but when we were growing up, the big thing was the tobacco industry, making sure kids stay off of drugs and tobacco products, cigarettes, e-cigarettes, and vapes is what we would equate that to now. But would you say that these two things are on the same level as far as how bad and how crucial this issue is?
Sure. So what we do know is when the Surgeon General warnings came out for the cigarette and alcohol use, we definitely saw major behavioral change. But what happened alongside those warnings, Jeremy, were significant public health campaigns, not just the warning itself. And so Dr. Murthy is calling not only for his Surgeon General warning to be approved by Congress, but also for a significant public health campaign to go out to raise awareness about the harms of significant social media use.
All right. Thank you so much for diving into this topic for us this morning. Your recommendations, of course, are on your blog on the website,
Yes.
wishtv.com. So, of course, you can find that there.